see you come in. How are you doing? So, you're here to pick up your prescription. Alright, what was your first name again? Okay. Last name, please. Okay, and could I get your date of birth? Okay, and street address. Oh, I know exactly who you are. One moment. Okay, so first one you're gonna have is your methimazole. Now, this is for your hyperthyroidism. Essentially what this does is this helps you to keep, are you familiar with your TSH levels? Okay, right. So, the higher your levels go, the more imbalanced you will be. Now, what I mean by that is, have you noticed that you've been feeling kind of manic lately? Like, perhaps you've felt that you just have this fluttering feeling in your chest, or maybe you've had a lot of anxiety lately. Would you relate to that? Well, essentially, what this will do is bring down those TSH levels. Now, the unfortunate thing is, now that you've got hyperthyroidism, which is why I'm giving you this, you will eventually go hypothyroid. Now, when you go hypothyroid, you will have the opposite effect. You will find yourself very tired a lot of the time. And actually, fun fact here, if you miss your medication once you go hypothyroid, you can go into a coma. So, lovely, right? But, I mean, that won't happen. I got faith in you. But now what you want to do, take 2 tablets once daily. So this right here is your 60 tabs. This is 5 milligrams. You're going to be taking 2, which will equate to 10 milligrams. And basically, yeah, this'll, I would say, give it 3-4 months, and your levels will come down to baseline. I'm going to have you come into our phlebotomy lab, and basically they're going to also take your blood, measure your blood levels for all that good stuff, TSH, even other stuff, just to make sure that everything is going, good. And then we'll have you go and see your GP, and perfect. Now, for your next prescription, we have your Vyvanse. Now, Vyvanse, of course, as you know, you have adult ADHD. Now, what this does is, interesting thing, in people who don't have ADHD, this will cause them to go off the walls, kind of bounce around, go loony. And the reason for that is that these capsules are actually like a derivative of an amphetamine. Now, I know what you're thinking, but no. Well, actually, there is an actual methamphetamine pill, but we don't sell that. You can't even get that in Canada. Believe me, we've tried. But, no, I'm just kidding. It's a joke. But, with these, this is a 40 milligram. Now, obviously, the technical name is lysodexamphetamine dimesylate. 40 milligrams. You take this once a day. I've heard of people taking it twice a day. You don't need 80 milligrams of Vyvanse. So take this once a day, either in the morning or the afternoon. Wait about 24 hours and you'll be good to go. And what this will do is it'll help you to increase your ability to focus. Because interestingly, in individuals who have the chemical imbalance which causes attention deficit hyperactivity disorder, this pill will calm you down. It will level you out. We give it to school children as well as mostly, I would say 8th grade to high school level. Younger than that, we generally don't give it out just because it just feels strange to give amphetamines to children. But to older individuals, young adults, and actual adults, yeah, we'll give this out to them, and it usually sorts them right out. So, there you go. Might I interest you in some rubbing alcohol? It's quite nice. No, not even for wound care. Fair enough. Now, this is a Tiva salbutamol HFA. So, obviously don't heat this, and I actually have an instruction sheet for you right here. Oh, I'm sorry. This one is actually for your 5 ants, but since they're here, let me just read this for you. Now, this is lisdexamphetamine 20 milligram capsules, and the generic name is lisdexamphetamine or lisdexamphetamine dimesylate. Now, misuse or abuse of amphetamines may cause serious, possibly fatal, heart and blood pressure problems. Amphetamine-type medications can be habit-forming, so don't be messing around with it, and don't sell it to your friends. Use only as directed. If you use this drug for a long time, you may become dependent on it and may have withdrawal symptoms after stopping the drug. Consult your doctor or pharmacist for more details. Now, lisdexamphetamine is used to treat attention deficit hyperactivity disorder as part of a total treatment plan, including psychological, social, and other treatments. It may help to increase the ability to pay attention, stay focused, and stop fidgeting. Lisdexamphetamine may also be used to treat binge eating disorder, and it may help reduce the number of binge eating days. This medication is a stimulant. It is thought to work by restoring the balance of certain natural chemicals, neurotransmitters, in the brain. This medication, though, is not recommended for weight loss due to the risk of serious side effects. Now, read the medication guide, which was provided by me before you start taking this, and each time you need a refill. If you have any questions, ask your GP or your pharmacist. So, I want to tell you a little bit about the side effects of this, just so that you're aware. Nausea, vomiting, constipation, stomach or abdominal pain, loss of appetite, dry mouth, headache, nervousness, dizziness, trouble sleeping, sweating, weight loss, irritability, and restlessness may occur. If any of these effects last or get worse, tell me. And remember, this medication has been prescribed to you because your doctor has judged the benefit to you is greater than the risk of side effects. Many people using this medication do not have side effects. This medication may raise your blood pressure. Check your blood pressure regularly and tell your doctor if the results are high. Tell your doctor right away if you have any serious side effects, including blurred vision, fast pounding or irregular heartbeat, mental or mood behavior changes like agitation, aggression, mood swings, depression, hallucinations, abnormal thoughts or behavior, or suicidal thoughts or attempts, uncontrolled movements, muscle twitching or shaking, signs of blood flow or problems like, have you heard of Raynaud's? So, one of your fingers will turn white because there's a lack of blood flow and it becomes very cold. Now, if this lasts, this can be very bad because no blood flow to your finger means eventually no finger, right? Think of like frostbite. It's very uncomfortable. Raynaud's phenomenon, search it up. Now, unusual wounds on the fingers or toes, outbursts of erections in males. Get medical help right away if you have any very serious side effects, including shortness of breath, fainting, chest, jaw, left arm pain, which can indicate a heart attack, seizures, obviously, weakness on one side of the body, which can indicate stroke or heart attack, trouble speaking, confusion, sudden vision changes. This medication may increase serotonin. You gotta be careful of serotonin syndrome. Basically, that can hack you up, but, now, back to the inhaler. Basically, you know how to use this thing. You open it, do the puff. I want you to do this one. Let's see. You have 200 pushes here, because basically where it is, they fill it up like that. You can see. And what they do. Oh crap! I accidentally sprayed it. But what it is they fill it up in a machine. Gets the fluid in there, or the aerosol in there. You spray it in your mouth. Inhale, and then hold it for about 10-20 seconds. I use 4 puffs each time, which you're not supposed to do. You're supposed to use like 2 puffs puffs each time. It says inhale 1 or 2 puffs every 4 hours as needed. So that's only when you're needed. But you also have this one. This is your fluticasone. This is your orange inhaler. This one you do twice every day. This is meant to be like a steroid that builds up the power of your lungs, like so. Another reason for this one. This is called a rescue inhaler informally, but this is your daily inhaler. Now, you're going to want to make sure that you wash your mouth out after you use this, and if you get a little bit of like tightness in your throat, don't panic. That's merely a result of the steroid. See, your throat isn't used to having steroids on it. It may be an uncomfortable sensation, but it's not any danger. I've had this for 30 years. Not any danger. So remember, rescue inhaler, this will help you more and instantly, but you don't want to use it as much if you can because you don't want to build up a tolerance to it. And this is the steroid inhaler that you are meant to take every day. If you take this every day, the goal is to build up the strength of your lungs. It really helps with asthma, but it's not a sudden thing. It takes time. Now, allow me to redo this. So, famotidine. Oh, this is not. This is for GERD. Okay. Since we have your GERD medication coming up, your Pepcid. Famotidine 20 milligram tablets. This is oral, by the way. So, famotidine is used to treat ulcers of the stomach and intestines and to prevent intestinal ulcers from coming back after they have healed. This medication is also used to treat certain stomach and throat esophagus problems, such as erosive esophagitis, gastroesophageal reflux disease, and Zollinger-Ellison syndrome. Pepcid works by decreasing the amount of acid your stomach makes. It relieves symptoms such as a cough that doesn't go away, stomach pain, heartburn, and difficulty swallowing. Famotidine belongs to a class of drugs known as H2 blockers. Now, this medication is available without a prescription. You can actually go and get like the brand name Pepcid. You can find it on shelves and it's relatively easy to get. We used to sell something called Zantac and they had like a nifty mint flavored one, but the thing is we had to take that off the market due to some issues it was having. They found something in it that could cause cancer, so they got rid of it. I actually used to take a lot of Pepcid back in the day. But anyways, it's used to prevent and treat heartburn and other symptoms caused by too much acid in the stomach. If you're taking it for self-treatment, it's important to read the manufacturer's package instructions carefully so you know when to consult a doctor or pharmacist. Now, pay close attention. Take this medication by mouth with or without food as directed by your doctor, usually once or twice daily. I would recommend in the morning and at lunch. You can also do it in the morning and at night because I find that overnight when you're laying down, GERD can kind of be agitated if you are not at a level. I recommend getting a wedge pillow so that you'll be sitting up kind of because it prevents any like stomach acid from going up the esophagus and it allows you to just kind of get a better sleep without the chance of, stomach acid going up into your throat, which does happen actually due to the weakening of the esophageal sphincter. Yes, we have more than one sphincter. We have several. We have the butt sphincter. We have the esophageal sphincter. They're sphincters, my friend. Now, the dosage and length of treatment are based on your medical condition and response to the treatment. Children's dosage may also be based on weight. You can take other medications like Tums for your condition as recommended by doctor, so you can kind of take your Tums and your Pepcid and it'll work together. It's pretty good. Follow your doctor's instructions carefully. Consult your doctor or pharmacist if you have any questions. Many people using this medication do not have serious side effects. Tell your doctor right away if you have serious side effects like easy bruising or bleeding, which is petechia, basically a weakening of the platelets. It's like, imagine like a really close-up bruise that was red. It's like bleeding right under the skin. There's actually a way you can test if it's petechia. Like, look at your hand, right? Say there was a red spot. If you put pressure on it, you'll notice that the skin will turn pale. If it doesn't turn pale and stays red, like compare it to like a birthmark or a beauty mark, you know how that skin will keep the pigment even if you put pressure on it. A petechia is bleeding underneath the skin and it'll stay like that. It won't get paler. That indicates bleeding under the skin. In my personal experience, I have had it, and it's, for me, I believe, due to untreated celiac disease. It's an autoimmune thing, but it can be caused by anything. It is kind of a bruise. Now, so make sure if you have any signs of infections like a sore throat that doesn't go away, or fever and chills, mental or mood changes such as restlessness, confusion, depression, or hallucinations, that you get medical help right away. Very rare side effects are fast, slow, or irregular heartbeat, severe dizziness, fainting, and seizure. And obviously, anybody can have an allergic reaction to anything, but with this stuff, very rare. Very, very rare. Obviously, like if you can't breathe, make sure you call 911. And I would recommend, for the first time, I've got health anxiety too, I'd recommend taking it in the presence of family, just to be safe. But yeah, let me see here. Maybe I can offer you some bandages. No. How about some, oh, and one other thing about that GERD, gastroesophageal reflux disease, don't heck with it, because GERD will leave you hecking third, and you don't want that. Now, how about this polysporin? You want some polysporin? Kind of smells like honey. Pretty good. No. Okay. Hang on, I got you. Casino halls. Would you like some halls nasal thingies? Yeah, I don't know why they make it either, but they do. No? Okay. Hold up. I got you, my man. How about this? Vicks Vapo Inhaler. Check this bad boy out. Check this. It sounds like a DJ thing. Now, it's got a very nice kind of menthol scent to it. Clears your sinuses right out. No? Okay. Oh. I got you. Ricola. Remember the ad? Ricola. This one is berry medley, made with Swiss alpine herbs. And did you know that marshmallows are an actual like plant? It's like a little plant, and it grows in a marsh. Wild, right? I didn't know that. No. Okay. You ever have any really stank breath? This is TheraBreath. It's like a xylitol mint. Check this out. They're cool little square mints. I love these things. I sometimes have stank breath. You could tell. It's just as normal. Okay. No. You don't want that. How about Restore Fiber? Come on, man. I'm trying to make a sale. Whatever. It's cool. I'm just happy that you've got your meds, that you're doing well, and, that you're just on the path to recovery. I think I'll be real with you. I don't even have a license to be a pharmacist. I was actually living in a back alley and they just hired me. But I mean, it's cool. I like it. I dig it. I'm making a positive difference. I haven't killed anybody yet. So yeah, it's awesome. But I'll see you next time you come in for your meds. Have a good day and watch your step. There are needles outside the building.